Hi, my name is Jennifer Diaz and I'm a student from the Cedar Crest College Nursing Program. I will be discussing a research study done on the relationship between simulation and nursing education and medication safety. The key points I will be discussing are problem and purpose, model type, research question, variables, intervention, ethics, data collection and procedure, results, implication, limitations, and conclusions. The purpose of this study is to identify if nursing students participated in simulation labs, could it reduce medication errors? Because the research problem is medication administration errors are due to students not having enough experience and or being distracted when administering medication. The model in the research is conceptual. Research has shown that the more nurses that have a bachelor's degree on a unit, the lower the mortality and the lower the failure to rescue the patient becomes. Medication errors have been linked to not having sufficient experience as well as being distracted. The simulation labs are designed to help nursing students reduce medication errors and try to identify the distractions that may lead to medication errors. The researchers' focus was to answer, does the use of simulation labs by the second year of being a BSN student in med-surg and maternal child placement environment influence the student's ability to safely administer medication? As I explain the study, it will answer the question. The study's independent variables were the simulation experience and the clinical experience. The dependent variables were the nurses' skills to administer medication and clinical units that the nurses were placed in, being either the med-surg or maternal child unit. The intervention done in this research was the replacement of clinical hours with simulation experience before the student nurse were to administer medication. Simulation labs offer nursing students the opportunity to comprehend how to administer medication without error. On the other hand, clinical experience provides the nursing student with the opportunity to practice medication administration. Before the study was performed, the researchers got approval and were granted by an ethics board. All participants to the study volunteered, were eligible to participate, and were informed of the study's purpose and how the data was going to be collected. The sample in the study was the 54 nursing students who volunteered, and furthermore, the randomized control group. Post-test only was the design of the study. As you can see in the table, there are two groups. The control group that consisted of 18 students in the maternal child unit and 12 students placed in the med-surg unit, with a total of 30 students in the control group. The treatment group consisted of 10 students in the maternal child unit and 14 students in the med-surg unit, with a total of 24 students in the treatment group. Therefore, there were 28 total in the maternal child unit and 26 on the med-surg unit, totaling 54 volunteered students. Data collection in this study obtained the 54 volunteered student nurses, the data collection instrument based off of a survey that was developed by one of the authors, and the form that was to be completed by the clinical instructor. Validity of the study was determined as the reports being locked in a cabinet, the instrument being critiqued for accuracy, wording, and appropriateness by several experts, and lastly, the content of the exam being secured and the questions content being appropriate. Furthermore, the analysis was done by entering the results into the SPSS version 13 software. Questionnaire results were also analyzed for common thread and intercorrelation. Now the results of the study were as follows. Treatment groups had less medication errors during administration because of their exposure to simulation. On the other hand, control groups had more medication errors because of not having any exposure to simulation. The results of errors were based on actual errors, potential errors, lack of knowledge, and distraction. The results of the p-value were Poisson distribution is p-value less than 0.05, and the chi-square p-value is less than 0.001. The implications of the study that will be helpful and applied to nursing practices are: the nurses will perform better, they'll meet the instructor's expectations, they'll gain knowledge of medication administration, they'll have less knowledge gaps, it'll increase their critical thinking skills, and prioritize what is significant when administering medications. There are a few limitations to the study. There was a small sample size obtained. There were only 54 volunteer nursing students, and they were all from the same nursing program. The study used 2 community hospitals, which could have been using different medication systems. One may have been a friendlier user than the other. Each group of students had a different instructor, which may have provided bias to the study. And lastly, students had concerns because they had never been exposed to simulation and may not have participated due to the fear of failing. The study's conclusion is that simulation labs improve nursing student knowledge. The simulations give the students the opportunity to recognize their errors in knowledge or medication administration. Student nurses have the room to make error. Student nurses have the ability to reassess the scenario after further analyzing the situation. Clinical instructors also have the capability of replicating different clinical scenarios. Simulation lab also reduces medication errors, investigates patient safety, and lastly, should be replicated on a larger scale of student nurses using more than one program.